Hello all. So we are continuing our conversation in chapter 13. We're talking specifically about caffeine and ephedra today. Here we go. So caffeine is a bitter white alkaloid derived from various plants. It's a naturally occurring compound found in coffee beans, tea leaves, cocoa beans, and many other sources. Because of its prevalence and effects, it can be classified in many different ways. If we look at the classification, its versatility allows it to be classified as a food ingredient, a dietary supplement, or even a drug, depending on its use and concentration. This adaptability makes it a unique compound in the food and health industries. In addition to being naturally present in several plants, caffeine is also added to various food products. You'll find it in soft drinks, energy drinks, and even some snacks. Its stimulating properties make it a popular additive. Caffeine is, in fact, the most popular social drug in the United States. It's consumed daily by millions of people in their coffee, tea, and energy drinks. Its popularity is largely due to its stimulating effects, which help improve alertness and concentration. And caffeine has been theorized to enhance both health and exercise performance. Research suggests that caffeine can improve endurance, increase metabolic rate, and even enhance cognitive function. This makes it a valuable aid for both athletes and the general population. Did you know that 85% of the United States adults consume caffeine daily? It's widely accepted as part of our diet, with a normal therapeutic dose ranging from 100 to 300 milligrams. If we look at the caffeine content in some common products, for instance, an 8-ounce cup of brewed coffee contains about 96 milligrams of caffeine, while instant coffee has 63 milligrams per packet. Some products have significantly higher caffeine content. A 16-ounce grande cup of Starbucks featured dark roast coffee has 260 milligrams, and a 1.93-ounce bottle of 5-hour energy extra strength contains 230 milligrams. Energy drinks and pre-workout supplements can also be high in caffeine. A 16-ounce serving of Red Bull has 143 milligrams, and a scoop of Cellucor, or C4, original pre-workout supplement contains 150 milligrams. Over-the-counter stimulants like Vivarin tablets contain 200 milligrams of caffeine per tablet. And additionally, natural sources like guarana can have up to 250 milligrams per 5 grams. So understanding caffeine content in various products can help us make informed decisions about our consumption. Always check labels, especially over-the-counter stimulants and dietary supplements. Caffeine is a common ingredient in several classes of products designed to boost performance. These include sports energy drinks, sports gels, sports bars, and performance candy. Now, sports energy drinks are a popular choice among athletes and fitness enthusiasts. These drinks are formulated to provide a quick energy boost, often containing significant amounts of caffeine. Sports gels are another convenient option for athletes. These gels are designed to be easily consumed during physical activity, providing a concentrated dose of caffeine and other nutrients to maintain energy levels. While sports bars are a portable and nutritious snack, they often include caffeine among their ingredients. They offer a balanced mix of protein, carbohydrates, and caffeine to support endurance and performance. Performance candy is a newer addition to the market, offering a sweet treat that doubles as a caffeine source. These candies are designed to be both enjoyable and functional, providing an energy boost when needed. And for more information, you can check out www.caffeineinformer.com for an extensive database of drinks and foods containing caffeine. Caffeine has several effects on the body that can benefit exercise performance. The central nervous system stimulation. So by blocking adenosine, a neurotransmitter that promotes relaxation and sleepiness, caffeine stimulates the central nervous system. This can increase alertness, focus, and overall mental clarity, helping athletes maintain concentration and motivation during exercise. You also see enhanced muscle contraction. Caffeine can potentiate muscle contraction by increasing the release of calcium in muscle cells. This improved calcium release can lead to more effective and forceful muscle contractions, which can be particularly beneficial for activities that require explosive strength or endurance. Caffeine promotes the breakdown of glycogen in both muscle and liver tissues. By increasing the rate of glycogenolysis, caffeine helps maintain energy levels during prolonged exercise, delaying fatigue and improving endurance. Caffeine increases the release of free fatty acids from adipose or fat tissues into the bloodstream. This elevated availability of FFAs can enhance fat oxidation, sparing glycogen stores and providing an additional energy source during exercise. Caffeine also stimulates the use of muscle triglycerides, which contributes to energy production during prolonged activities. And with the rise in blood FFA levels due to caffeine, it helps improve fat utilization and endurance performance, especially in longer duration activities. So overall, these effects combine to enhance exercise performance by increasing energy availability, improving muscle function, and delaying fatigue. Here's a summary of caffeine use regulations and current limits for athletes and active individuals. From 1984 to 2004, caffeine use was prohibited by the International Olympic Committee, or the IOC, the World Anti-Doping Agency, and other monitoring organizations. In 1987, caffeine use was allowed with restrictions, especially with a urinary concentration limit of no higher than 12 milligrams per milliliter. In 2004, caffeine was removed from the prohibited list by WADA, but continued to be monitored in the in-competition monitoring program list. Now, the current use, the NCAA, or National Collegiate Athletic Association, the limit for urinary caffeine concentration is set at no higher than 15 milligrams per milliliter. These regulations reflect an evolving understanding of caffeine's effects and its place in sports performance. Caffeine's effects on psychomotor responses and cognitive function can be quite beneficial, particularly in the context of exercise and mental fatigue. There is an increased alertness and attention. So caffeine enhances that alertness and attention, leading to improved reaction times and mood. This can be especially useful during long or demanding activities. There's also an improved cognitive function and various aspects of cognitive function, including our memory, concentration, and problem-solving abilities. It can also boost vigilance during extended periods of exhaustive exercise and periods of sustained sleep deprivation, making it valuable for athletes facing long events or competitions with limited rest. Now, as far as effective doses are concerned, doses ranging from 80 to 600 milligrams have been effective in improving psychomotor responses, particularly when individuals are mentally fatigued. The optimal dose can vary depending on the individual and the specific context of use. While moderate doses are beneficial, high doses of caffeine greater than 400 milligrams can lead to negative effects. These may include increased nervousness, anxiety, and impaired performance in activities that require fine motor skills and rapid visual processing. So while caffeine can enhance various psychomotor and cognitive functions, making it a useful ergogenic aid in many contexts, excessive consumption should be avoided to prevent potential negative effects. Caffeine has been extensively studied for its effects on aerobic endurance performance, and the consensus in the scientific community is largely supportive of its efficacy due to its positive effects on endurance. So research consistently shows that caffeine can enhance aerobic endurance performance. It helps improve time to exhaustion, increase exercise intensity, and enhance overall endurance during prolonged aerobic activities. As far as the mechanisms of action, the benefits are attributed to several mechanisms that increased fat oxidation. So as caffeine enhances the breakdown of fat stores, providing additional energy sources during exercise and sparing that muscle glycogen. And also with the enhanced muscle contraction. By increasing the calcium release in muscle cells, caffeine improves muscle contractility and efficiency. And just the reduced perceived effort. Caffeine can lower the perception effort during exercise, allowing individuals to exercise at higher intensities with less perceived strains. Numerous studies, reviews, meta-analyses, as well as position statements from organizations like the International Society of Sports Nutrition and the American College of Sports Medicine affirm the effectiveness of caffeine as an ergogenic aid for endurance activities. For most individuals, doses of about 3 to 6 milligrams of caffeine per kilogram of body weight are effective. This range provides a balance between enhancing performance and minimizing potential side effects. So while it is generally beneficial for endurance performance, individual responses can vary. It's important to consider personal tolerance and potential side effects such as gastrointestinal discomfort or jitteriness. Caffeine's effects on high-intensity anaerobic exercise are less studied compared to its impact on endurance performance. But some research suggests that there are several benefits. The body of research on caffeine's ergogenic potential for anaerobic performance is smaller than for aerobic endurance. However, the available studies indicate that caffeine can be beneficial for high-intensity activities. Those activities that involve short bursts of maximum effort, typically lasting between 10 to 18 seconds, or intermittent high-intensity sports such as soccer, lacrosse, and field hockey. As far as the effects on high-intensity intermittent exercise, there is improved performance. Caffeine has been shown to enhance performance in activities characterized by intermittent high-intensity efforts. This includes improved power output, faster sprint times, and better overall performance during periods of intense activity interspersed with brief recovery periods. In sports with prolonged duration, like soccer matches, caffeine can help maintain performance levels over the course of the game. This benefit is particularly useful in managing fatigue and sustaining high-intensity efforts throughout the event. Again, the mechanisms are enhanced muscle power. So it can improve muscle power and strength, contributing to better performance in short, intense bursts of activity. And by boosting alertness and reducing perceived exertion, caffeine can enhance an athlete's ability to maintain intensity during high-stress periods. So athletes participating in high-intensity intermittent sports might find caffeine useful for improving their performance, especially if the activity involves repeated bouts of maximal effort over an extended period. Caffeine's effects on muscle strength and endurance have been well researched with evidence supporting several beneficial outcomes. Increased strength, so isotonic strength specifically, caffeine can enhance, which involves the muscle contraction with movement such as lifting weights. So isotonic, we talked about it earlier, but the shortening and lengthening of the muscle groups. Isometric strength, it improves isometric strength where muscle contraction occurs without joint movement, with holding a static position like a plank or a wall sit. And then isokinetic strength. Caffeine has been shown to increase isokinetic strength where muscle contraction occurs at a constant speed, such as during certain types of resistance training or with rehabilitation, and with improved muscular endurance. Caffeine can enhance muscular endurance provided by allowing individuals to perform more repetitions and sustain muscular contractions for longer periods of time before fatigue sets in. Caffeine helps improve velocity and power in muscle contractions, which can be beneficial for activities that require explosive strength and rapid movements. And regular caffeine consumption may support better adaptations to resistance training by increasing strength gains and improving overall performance during workouts. The likely mechanism through which caffeine exerts these effects is the adenosine A2A receptor blockade by Blocking these receptors, caffeine reduces the inhibitory effects of adenosine, leading to enhanced neuromuscular function and performance. A dose of 2 to 3 milligrams of caffeine per kilogram of body weight is generally effective in improving muscular strength and endurance. While caffeine's effect on carbohydrate and fat oxidation have been studied with respect to its potential ergogenic benefits, the early research suggests that highlighted caffeine's ability to increase fatty acid mobilization from adipose tissue, which was thought to enhance fat oxidation during exercise. The idea was that by increasing fat oxidation, caffeine could spare glycogen stores, thus prolonging endurance performance. But more contemporary findings indicate that caffeine can increase carbohydrate utilization during exercise. This means that while caffeine may help mobilize fats, it's also promoting greater use of carbohydrates for energy. And although caffeine increases the mobilization of fatty acids, there is limited evidence that it significantly boosts fat oxidation during exercise. The primary effect observed is an increased rate of carbohydrate use rather than a substantial increase in fat oxidation. The current evidence does not strongly support the idea that caffeine leads to glycogen sparing. Instead, caffeine's effect on endurance may be more related to improved performance through other mechanisms such as enhanced muscle contractility and reduced perceived effort. According to the Institute of Medicine, moderate consumption of caffeinated beverages, including coffee and tea, is generally considered safe and may even offer health benefits. These benefits include reduced risk of certain diseases. Some studies suggest that moderate coffee consumption is associated with a lower risk of certain diseases such as type 2 diabetes, Parkinson's disease, and certain types of cancer. There's improved cognitive function. Caffeine in coffee and tea can enhance alertness, concentration, and cognitive function. There are also antioxidant properties. So coffee and tea are rich in antioxidants, such as polyphenolic compounds, which may help reduce inflammation and oxidative stress. There are health benefits beyond caffeine. Coffee specifically contains various bioactive compounds that may contribute to health benefits beyond caffeine alone. These include antioxidants and anti-inflammatory substances. Tea is rich in catechins, especially EGCG, which have been linked to potential health benefits such as improved cardiovascular risk and reduced cancer risk. Earlier research raised concerns about potential health risks associated with coffee and caffeine consumption, including cancer. Some studies suggested a possible link between coffee consumption and cancer, but most recent research has not supported these findings consistently. Early studies also indicated a potential link between high caffeine intake and heart disease. However, current evidence suggests that moderate consumption does not significantly increase heart disease risk. High caffeine intake was once thought to affect bone density negatively, but evidence now suggests that moderate consumption has minimal impact. And birth defects. Excessive caffeine intake during pregnancy was associated with some risk, but moderate consumption is generally considered safe. There are concerns about added caffeine and increased products. So the proliferation of caffeinated products such as energy drinks and caffeinated snacks raises concerns, especially among populations with lower caffeine tolerance, such as children and adolescents. There are health risks for caffeine-naive populations. Excessive caffeine consumption can lead to issues like anxiety, sleep disturbances, and cardiovascular problems, particularly in individuals who are not accustomed to caffeine. If we look at the caffeine content in popular energy drinks, there is a wide range of caffeine levels. So energy drinks vary widely in their caffeine content, ranging from 5.75 to 16.2 milligrams per fluid ounce. This can lead to significant variations in caffeine intake depending on the size and quantity consumed. If we look at the market impact, U.S. energy drink sales reached approximately $15.4 billion in 2016, reflecting their widespread popularity. There are health concerns associated especially with the effects on youth. So the dietary recommendations were advised by the American Academy of Pediatrics that basically says children and adolescents should avoid caffeine and stimulants found in energy drinks due to potential health risks. High caffeine consumption in young people can lead to adverse effects such as an increased heart rate, hypertension, anxiety, and sleep disturbances. And with an increased risk of high alcohol consumption associated with mixing caffeine with alcohol. So combining energy drinks with alcohol has been linked to drinking larger quantities of alcohol per session, which can increase the risk of alcohol-related harm, including impaired judgment and risky behaviors. There is a higher incidence of dangerous behaviors, such as driving under the influence or DUIs when energy drinks are mixed with alcohol. And as far as FDA regulation safety concerns, in November 2010, the FDA declared that caffeine is an unsafe food additive to alcoholic beverages. This regulation was put in place to address concerns over the combined effects of caffeine and alcohol, which can mask the depressant effects of alcohol and lead to excessive drinking. Caffeine dependence or caffeineism is a recognized condition involving the habitual use of caffeine that can lead to physical dependence. Now, the World Health Organization includes caffeine dependence in its classification of mental and behavioral disorders, acknowledging it as a legitimate condition within its diagnostic framework. The American Psychiatric Association released in 2013 the DSM-5, which is the Diagnostic and Statistical Manual 5, and it includes a caffeine withdrawal as a diagnosis under caffeine-related disorders. This recognition highlights that withdrawal symptoms from caffeine, such as headaches, fatigue, and irritability, are clinically significant. Now, individuals who consume caffeine regularly may develop a tolerance requiring higher amounts to achieve the same effects. And abrupt cessation or reduction in caffeine intake can lead to withdrawal symptoms, including headaches, fatigue, mood disturbances, and difficulty concentrating. Caffeine dependence is generally not regarded as a serious form of drug abuse compared to substances like opioids or alcohol, and typically does not lead to severe health or social consequences. For most individuals, reducing or eliminating caffeine intake can alleviate withdrawal symptoms and dependence, often through a gradual reduction approach. To summarize the positions on caffeine, generally, caffeine is considered to be safe. Most professional health organizations classify it as a safe drug when consumed in moderate amounts. This reflects its widespread use and acceptance in daily diets. A moderate caffeine intake is generally considered to be between 200 to 300 milligrams per day. This is roughly equivalent to the caffeine content found in about 6 to 8 ounce cups of coffee. There are precautionary measures when pregnant women are intaking caffeine. And so pregnant women are often advised to limit or avoid caffeine consumption, similar to recommendations for alcohol, due to potential risks of fetal development. There is also individual variability based upon our genetic factors. Some individuals may be more sensitive to caffeine's effects due to genetic variations. These individuals might experience adverse effects even with moderate intake and should monitor their caffeine consumption accordingly.